Now, you've told me that in the past, your program has been based on disease prevention and longevity and age management. Well, now, in fact, you say you had a blind eye toward looking for disease. You didn't look for disease before, but you've changed your mind on that, or your approach.
I have. Age management medicine is really all about preventing disease. It's not about looking for disease and then treating it. I've changed my mind about that because even though I've been on the right kind of exercise program and the right nutrition and supplements and have my hormones perfectly managed for the last 13 years, I have recently come to the realization that the first 60 years of my life have left a mark.
Okay.
I have cardiovascular disease, the #1 killer of Americans. Half of all Americans die from cardiovascular disease. This has really kind of made me rethink this whole idea about healthy aging. And now I really think it's very important that I include looking for disease in my practice.
Interesting. Okay. So it's like a separate program.
It's a separate
for
program.
People and where you're actually looking for disease.
That's right.
Okay.
It's a separate
like heart disease. What else?
It's a separate program to look at the indicators of vascular disease through sophisticated instruments and through the right kind of blood chemistries, so that I can diagnose vascular disease early and prevent heart attacks and strokes. That's what my whole new program is about, preventing heart attacks and strokes.
So you're convinced that you can have an impact or even prevent strokes and heart attacks?
Absolutely. People do not have to die of heart attacks and strokes.
So for patients that are relatively physically fit, they monitor their cholesterol, maybe they get a stress test here and there, you think there's more that can be done?
Absolutely. And you know, this concept is one of the biggest disasters we have in medical care today.
Okay.
That by simply monitoring cholesterol levels, we can prevent heart attacks. You know, half of the people that die of heart attacks have normal cholesterol levels.
Is that right?
That's right. And the other misconception is that stress testing will pick up disease and we can prevent heart attacks by doing stress testing. 86% of people that have heart attacks have disease in their blood vessels that cannot be picked up with a stress test.
So what's the answer then?
The answer is to not base everything on risk factors.
Okay.
You know, 86% of people that have passed the risk factor test can die of a heart attack the next day. The answer is to look for vascular disease. Look for the disease.
And how do you do it?
Well, it's really quite intuitive. If you want to prevent colon cancer, what do?
I guess you get a colonoscopy.
Exactly. Okay. Why do you get a colonoscopy?
Early detection.
That's exactly right. Pick up the cancerous polyps when they're little, and they can be plucked out of there. So why don't we use the same common sense approach to heart disease?
So get imaging early.
Get imaging early. This is the answer.
Interesting.
To pick up disease early, not base our entire approach to heart disease that kills half of all Americans on risk factors that for the most part don't give us a good idea about someone's risk for dying of a heart attack. Do you know that half of the people that have heart attacks, you know what their first symptom is?
What is it?
Sudden death. This is absolutely a catastrophe in this country. We need to change our approach completely. And that's what my new program is all about.
So currently, right now, just so I understand this correctly, because I haven't been evaluated, they do a stress test, and then they look at the cholesterol.
Okay, they look at the risk factors, which is heart disease, smoking, age, gender, and cholesterol levels.
Okay.
And if you fall into any of those categories, then that puts you at risk. Then they'll do a stress test, which is supposed to be the thing that determines whether you're at risk for a heart attack or not. And 86% of the people with significant heart disease will pass the stress test and die of a heart attack.
It's not enough. It's not enough.
It's not enough.
Then you say people with low cholesterol die of heart attacks every day.
Half of the people that die from heart attacks have normal cholesterol levels.
So just like early detection breast cancer, early detection colon cancer, you're saying image the veins.
Exactly. Early detection of cervical cancer, breast cancer, colon cancer.
I mean, nobody disagrees with this, by the way, that early detection works, right?
That's right. But why aren't we? The mystery is, why are we not looking for disease where it is, instead of looking at all these other things that really don't tell us that there's disease or not?
So this is the Dr. Life Heart Program, or what are you calling
This
it?
is the Heart Attack and Stroke Prevention Program, the Life Center Heart Attack and Stroke Prevention Program.
Who should look into this? Somebody that it runs in their family, or somebody with symptoms? Shortness of breath, high cholesterol?
Everybody, I'd say age 45 and older. You know, the vast majority of my patients, my male patients, already have disease. And if I know they have disease, there's a lot I can do about it to stop the disease and reverse it.
So well-known guys like Tim Russert or
Tim
President
Russert.
Bill Clinton and things like that, they just had stress tests.
Tim Russert had a stress test just 2 or 3 weeks before he died.
Is that right?
That's right, and he passed the stress test.
But if they would have looked at his arteries or his veins,
If they would, well, they knew
Your
they knew he had vascular disease.
okay.
But nothing was being done aggressively to stop the progression of his vascular disease. He was being treated with the standard of care in America. And the standard of care for heart disease kills people.
So is there a specific age range that they should get involved in the heart program?
I think men and women that know they have a family history of heart disease, if they know they've had high cholesterol levels, or if they just want to find out if they have vascular disease, should go through this program. Because there is so much that can be done to stop the progression of the vascular disease before it culminates into a heart attack or stroke. Heart attacks and strokes can be prevented.
Okay, so we're going to go to a break, but your overall approach then is what, as a recap?
My approach is to find disease early, find evidence of vascular disease early, and then treat the disease, not treat risk factors, but treat the disease, and then follow the disease and make sure it is stopped and regressed.
So you can do comparative studies to show that they're
Absolutely.
progressing.
Absolutely.
Or at least it's not getting worse.
Absolutely. Studies of the blood vessels, the lining of the blood vessels, blood chemistry markers of progression, of inflammation. I do all that as part of this heart attack and stroke prevention program.
Just call your office.
Call my office.
And the specific age, I know with colon cancer, I believe it's, at 40 plus, go in, get a colonoscopy, or
Well,
50.
it's 50.
50. And, with women with breasts, even though it's controversial, 40, 50, somewhere in there. And so when should somebody do this heart assessment?
I think anyone that has a strong family history of heart disease, any male
So what age?
in their 40s,
In their 40s.
should find out if they have evidence of vascular disease.
And especially if they have symptoms, shortness of breath, things
Well,
like
that's
I mean, will you see those patients?
sure, but by that time they need to be seeing a cardiologist.
Okay.
This is all about attacking this before people have symptoms. Early detection of disease. That's what this is about. And then stopping that disease and reversing it. So that people don't end up like I did, where 60 years of the wrong kind of lifestyle, and I end up having heart disease that I've had to work really hard to stop and regress it. If I had not started this program with Bill Phillips and then followed it up with Cenegenics, I'd be dead today. There is no question about it. And the reason I'm still active and doing what I do is because of the program I've been on, and that I've been through a heart attack and stroke prevention program as well, and have learned all these things.
Is this the program you've always wanted to start? I mean, are you most excited almost about this program?
I'm very passionate about this program.
I mean, this one could really save some lives.
This
You can prove
will
prove it.
save lives. Almost all my patients that I see have disease. Everybody, every male in his 40s, for the most part, has disease. And if we can attack this early, aggressively, we can stop heart attacks and strokes in this country. And I'm very passionate about it. This is very exciting for me.
Well, good.
It's worked for me, and it's worked for some of my patients that are now in this program.